Hi everyone, my name is Stefan, I'm a pulmonologist. In this video I'd like to discuss about a common problem that many patients face, and that is basically when they are given a diagnosis of asthma by one doctor, another doctor they may see for a second opinion might contradict that diagnosis and tell them, oh, you don't have asthma, or you have COPD. So you may be offered different diagnoses for the same symptoms that you are presenting to your doctors. And this is something that is really important, and I think not many people really discuss why that is, because many people are, well, the first reaction, we are human, and we tend to say that, oh, maybe the first doctor that we've seen wasn't good enough, or the second one wasn't good enough. So there are a lot of subjective sort of implications regarding this topic. But I would like to just point out that asthma is a very variable condition. So individuals who suffer with asthma may have days when they feel absolutely perfect. Nothing is wrong. They feel absolutely fine, breathing's fine, they can work hard, they can go to the gym, they can exercise, nothing's wrong. Whereas on some days they may feel really, really poorly, their breathing may be really tight, there may be wheeze, there may be coughing. In those circumstances, at which point in this variable disease you're seeing the doctor, you may be given a certain diagnosis. So this is quite important because it's not only the symptoms that are variable. So following this pattern, it's the same with spirometry. So spirometry, or lung function testing, is basically a breathing test in which you breathe into a tube forcefully, and we measure how much air you can move and how quickly. And when you do spirometry, it's obviously a very effort dependent test if you have to breathe into a device as hard as you can. So obviously some patients, depending on where they perform the spirometry and who does the spirometry, whether the machine was well calibrated or not, they may have variable results. So again, the spirometry may be perfect on some days in individuals with asthma, and then on another day it may be terrible. So this is very important to note as well, because that also forms part of the diagnostic algorithm for asthma. The same goes for blood tests. So some doctors may request certain blood tests to test for allergy. So this may include the measurement of eosinophils, or something called IgE, which is basically an immunoglobulin in the blood, which is related to allergies. And levels of these markers in the blood may also vary. So again, this is another piece of the puzzle when we diagnose asthma. Also, in individuals who are, say, a little bit older, say over 40 years old, who maybe have smoked throughout their lives, there is also the implication of having COPD, which is sometimes very similar to asthma. It can also have a slight degree of variable symptoms, but it's generally sort of a more consistent impairment in your breathing. But again, at older ages, you need to consider this as a diagnosis as well, in addition to asthma. And people can have something we call an overlap syndrome between asthma and COPD. So this may also complicate things when you're getting a medical opinion. Another issue to point out is that sometimes people who have a viral infection and have no asthma, they may actually have something called bronchial hyperresponsiveness, which just means that airways are inflamed after the viral infection. It takes maybe a few months for them to recover back to normal. And during that time, your breathing will behave as if you have asthma. So you might have the same sort of symptoms. You might have slight irritation in your airways, chest tightness, coughing, a residual sort of wheeze. So these sort of things may still be there. And if you see a doctor at that time, maybe your spirometry is also quite bad. And it's again one thing that might be considered asthma, but maybe it's not. Maybe you'll recover back to normal. The most important thing that I wanted to actually share with you, and the main point of this video, is that it's important to maybe see your doctor several times. This is not because I want you to spend your money on seeing doctors, but it's just because it's always better for the same person who knows your case, knows the details, to see what happens to your disease, how it behaves over time, because then they may be in a better position to give you a more accurate diagnosis, to really tell you whether it's asthma or not, and to also see the response to treatment. So for example, in asthma, if we suspect asthma at the first visit, we may start a treatment with an inhaler, and then we may bring you back into clinic in like 2-3 months to check how you are responding to that treatment. And if you're responding well, at that stage we can maybe continue the treatment, or we may reduce the treatment or increase the treatment based on the response, or we may order further tests in order to get closer to the real diagnosis. And I understand this can be frustrating, but I think it's important for me to explain these issues because unfortunately sometimes medicine requires a little bit of patience in order to get to the right diagnosis. Hope this was helpful. Hope it was a useful comment. If you have any other questions, do leave them in the comment section below. If you like this content, do subscribe to the videos, and hopefully I'll see you again next time. All the best and good health.